There are patients who constantly clear their throat for not just a few days, but months to years, that seems to defy all explanation and resist all the usual standard treatments. Some of these patients have suffered from chronic throat clearing for years, resulting not only in frustration for the patient, but aggravation from loved ones and friends. Chronic throat clearing is difficult to treat mainly due to the many different possible triggers. As such, in order to properly diagnose and treat this issue, a comprehensive evaluation is mandatory. Numerous tests will be required with the attitude of leaving no stone unturned. Just trying medications is no longer sufficient. Let's go through all the possible causes and potential testing required. The esophagus is the swallowing tube that connects the mouth and throat to the stomach. Reflux, Zenker's diverticulum, and other forms of esophageal dysmotility can cause an irritated throat that will trigger a constant urge to throat clear. It is important to keep in mind that a patient who constantly throat clears may not have any symptoms beyond the throat clearing itself. All these symptoms may be absent: heartburn, throat burning, choking, lump in throat sensation, or trouble swallowing. However, if such symptoms are present, it does reinforce the possibility of some type of esophageal disorder. Workup for esophageal causes of chronic throat clearing include upper endoscopy with biopsies, barium swallow, 24-hour multi-channel impedance testing, manometry, and even spit tests. Sinonasal conditions such as allergies, chronic sinusitis, and vasomotor rhinitis can trigger a persistent throat clear due to post-nasal drainage. Workup for sinonasal causes of throat clearing include transnasal endoscopy, allergy testing, and CT sinus scan. Workup also includes a trial of 2 different nasal sprays, an antihistamine nasal spray as well as ipratropium nasal spray, to address vasomotor rhinitis for which no good test exists. Some patients who persistently throat clear ultimately find that certain foods trigger this symptom. The most common foods that have been found to cause throat clearing are wheat, dairy, and egg. Keep in mind that food sensitivities should not be confused with food allergies, nor should it be confused with foods that may cause reflux. There are certain drug classes known to commonly cause a throat irritation as a side effect, leading to throat clearing and/or cough. The biggest culprits are certain blood pressure medications known as ACE inhibitors. Less commonly, another class of blood pressure medications called angiotensin receptor blockers may also trigger constant throat clearing as a side effect. Finally, a patient may constantly throat clear due to an illusion of throat irritation. Patients suffering from chronic throat clearing may actually be suffering from nerve damage of the throat responsible for throat sensation. This condition is known as laryngeal sensory neuropathy. To use an analogy, a temporary sensory neuropathy occurs when a person gets a numbing shot at a dental office. When the jaw becomes numb, it is not unusual for the individual to feel as if the area has not only become swollen, but also to feel as if drool is constantly present. But when looking in the mirror, no swelling nor drool is present. Similarly, throat clearing due to neuropathy can be caused by a constant illusory throat mucus sensation. Once the cause of a person's constant throat clearing complaint has been determined, treatment can then be initiated with successful resolution. Keep in mind that it is not unusual in patients with constant throat clearing going on years that more than one cause may ultimately be found to be present, and as such, multiple different treatments may be required. A full workup may require seeing multiple different specialists including an ENT, gastroenterologist, allergist, and neurologist.